Hi, it is Rebecca Reinking, and I have some tips for you on words to start off with in therapy if your child has difficulty saying K and G. Now, often a lot of speech pathologists think that they have to start with the word in isolation. So I have to get the child to say K, or I have to get them to say G before we say a real word. Now, that is not true. I'm going to share with you some facilitative contexts. And these are words that are carefully chosen because they can facilitate or encourage or support a clear production because we've really thought about the environment of the sounds, be them vowels or other consonant sounds, surrounding our K and our G sound. And what I'm doing is I'm really thinking, how do I make a K and G? Like, what does the child need to learn? And really, it's just that the tip of the tongue stays down and the back of the tongue elevates. That's what's necessary. So if I can think of other vowels and consonants that share some of these features, I might be able to use them to my advantage and get the articulators in the right place so that it's just easier for the child to elicit or say a clear word or sound. Now, here's my first example. I guess I like to start with R, okay? And I know that that's a vowel sound, and I might say, the doctor might get you to say R, can you do that? And what I like about R, you can see right now my jaw has lowered, which is what we need for K and G. My jaw has lowered, and my whole tongue is down low, R. Now, all the child needs to do, because I've already got their tongue low, is just keep the front of the tongue down low, but just lift up the back. So I might try some words that end in K and G, but have a low vowel before it because it's getting the tongue low, or at least the front of the tongue low. And as we know, a lot of the child who have difficulties with these sounds usually substitute it with a T and a D. So they're lifting up the tip of their tongue. So we want to keep that tongue tip down low by having a low vowel before these sounds. It just can help encourage the back of the tongue to raise. And of course, with all this, you're likely to have to give cues, like lift the back of your tongue, or use your hand like I am as a gestural cue. So some of my favorite words for K to start off with and to probe to see if they might be easier for the child to say. And I'm going to read from our facilitative context packet here. Some of my favorite words are yuck. Now you watch when I model it slowly. You ready? Yuck. When I model it slowly, you can see that my tongue tip is down low and all I had to do was lift up the back. Some other good words are puck. I also like luck, and I might do something like muck, and again I might slow it down. Now I know I've just modeled the K in final position. You can swap it, you can start in initial position and have a low vowel after that sound. Something like cup might be helpful, something like come. So you might try those too. I'm always changing different positions to see. I'll give you some words that you might want to try that could facilitate a clear G sound. So at the end of words, you might try bug. And remember, we're slowing it down. Bug. I'm going to show you hug, and this might actually be the best word to start off with because my mouth is open and there's not a lot of movement. Ready? Hug. That looks a lot easier than bug, doesn't it? So I'm thinking about sounds. I'm thinking about sounds my child can say. I'm thinking, how can I make it as easy as possible for my child? The last one I'm going to share with you is a real sneaky little one. And it is where we are doing N-K words at the end. So there are going to be some words like oink and pink. Because when we have a word ending in N-K, N and K, with co-articulation, that NK is not clearly articulated like N, K. It's actually like an NG sound, And as we know, NG lifts or raises the back of the tongue. So you might be able to accidentally have the child raise the back of their tongue into that correct spot by choosing those words. So try pink and oink and see if those words are successful. Now, if none of those worked, that is okay. I always say that facilitative contexts are possible. Like, we are trying to see what is possible for the child and if any of them work. If those do not work, and if you've provided lots of additional placement cues, visual cues, you might try other facilitative contexts, because there's not just one. There's not like one magic position, one magic vowel, one magic consonant sound. In my experience, well, I screen for all of them. I screen for all possible facilitative contexts, and I see if the sound is clearer or easier, or maybe I provide less cues starting with these words, so that might be a best starting spot. So if you want to know what they all are, you can probe for them yourself. You can invest in our K and G sound handbook, or you can also look at our K and G facilitative context packet. Otherwise, a real DIY way that you can do this is grab all your K and G articulation cards in different positions and see if the child finds any of them easier to say. And then evaluate or analyze if there is a vowel or a consonant that helps the child say this. So those are just some quick little tips. If you want some more ideas on K and G sounds, make sure to see our other videos in the playlist, because I find this one of the most hardest sounds to treat. I like to put a lot of videos out there because one cue does not work for every child. I hope this helped. If you learned something new, please like this video. It really helps it get shown to more SLPs like you and helps support our goal of making more speech pathologists feel confident treating speech sound disorders.